Welcome back to Learn with MedNuggets. In this video, we will be talking about beta thalassemia. Beta thalassemia is an inherited microcytic hemolytic anemia characterized by defective hemoglobin synthesis. Hemoglobin is made out of heme and globin. There are 4 types of globin in our blood called alpha globin, beta globin, gamma globin, and delta globin. Different combinations of globin chains give rise to different types of hemoglobin. For example, alpha chains and beta chains make hemoglobin A. Alpha chains and gamma chains make hemoglobin F. Alpha chains and delta chains make hemoglobin A2. Hemoglobin F, as the letter F suggests, is the fetal form of hemoglobin. It's present at birth. Hemoglobin A and hemoglobin A2, as the letter A suggests, refers to the adult form of hemoglobin and is present in adults. Adults have more hemoglobin A in their blood than hemoglobin A2. At 6 months of age, hemoglobin F transforms to the adult forms of hemoglobin A and hemoglobin A2. In beta thalassemia, there's a deletion in the beta globin gene on chromosome 11. This leads to a reduction or absence in the production of hemoglobin A, so symptoms present after 6 months when transition occurs from hemoglobin F to hemoglobin A and hemoglobin A2. Alpha is unfaithful. When she doesn't have beta, she goes with gamma. So these patients will have high levels of hemoglobin F in their blood, diagnostic of beta thalassemia. Beta thalassemia can be due to a heterozygous mutation which can lead to thalassemia minor or a homozygous mutation which can cause thalassemia intermedia or thalassemia major. In thalassemia, abnormal red blood cells with abnormal hemoglobin is broken down in the bone marrow or by splenic macrophages. The splenic macrophages work hard to clear all the abnormal red blood cells from the blood, which can lead to an overactive spleen. This is called hypersplenism. Hypersplenism can lead to splenomegaly. This red blood cell breakdown signals the bone marrow to produce more red blood cells. As the bone marrow produces more red blood cells, it starts to expand. Expansion of bone marrow in the skull leads to a hair-on-end appearance which can be seen on a skull X-ray. Expansion of facial bones can cause frontal and maxillary bossing, exposing the upper teeth, which can give a chipmunk appearance to the face. As bone marrow expands, it becomes brittle and weak, increasing the risk of fractures. With time, the bone marrow can't keep up with the hemolysis, so it signals other places in the body outside or other than the medulla of the bone, extramedullary sites, to produce red blood cells, like your spleen and liver, causing splenomegaly and hepatomegaly. Thalassemia can be diagnosed by a blood test showing a low level of hemoglobin and a low mean corpuscular volume and a high red blood cell distribution width. A blood smear showing target cells that are microcytic and hypochromic, and labs showing high levels of iron, ferritin, and transferrin levels. You can confirm the diagnosis by a hemoglobin electrophoresis or a high-performance liquid chromatography, as this will show the levels of different types of hemoglobin in your blood. The treatment of thalassemia depends on the type of thalassemia. Thalassemia minor generally requires no treatment. Thalassemia intermedia sometimes requires blood transfusions, while thalassemia major requires blood transfusions all the time. Watch out for signs of iron overload when giving blood transfusions, as blood is iron. So always make sure to give iron chelators such as deferoxamine along with blood transfusions to these patients. Splenectomy can also be performed in patients with splenomegaly. Thank you for listening. Have a great day.